Good morning, everyone. Welcome to virtual class. By the way, I'm Jamalia and I'm your map teacher this morning. Topic this morning is all dressing slash bandaging and types of transporting of an injured person. Objectives. A. Explain the purpose of dressing and bandage. B. Demonstrate the appropriate bandaging techniques for common unintentional injuries. C. Identify the different types of carrying and transporting of an injured person. D. Demonstrate proper techniques in carrying and transporting an injured person. Dressing and bandage. A dressing is a piece of sterile cloth that covers a wound to prevent infection and or to stop bleeding. Techniques in applying a dressing. Wash hands and wear gloves, if possible. Unwrap the dressing as close to the wound as possible. Be sure not to touch the wound. Skin is not sterile. If the dressing slips over the victim's skin while you are trying to position it, discard and use a fresh one. Place the dressing over the wound. Use a dressing that is large enough to extend at least 1 inch beyond the edge of the wound. If body tissue or organs are exposed, cover the wound with a dressing that will stick. Then secure the dressing with a bandage or adhesive tape. Cold compress is used to reduce swellings and relieve pain, especially used for sprains and strains. Cold packs can be used as cold compress. Hot compress is also used to allow normal blood circulation. Cold and hot compress are applied alternately for closed wounds for contusions. Bandages are used to apply pressure to bleeding, for covering wounds and burns, and providing support for immobilization for broken bones, sprains and strains. There are three main types of bandage, namely triangular ACE and tabular. Tabular bandage is made from cloth and can be used as cold compress, padding support for pressure, or support sling. ACE bandage secures dressing in place. Tabular bandage is used to support joints or hold dressings in place. Smaller tabular bandage is used for finger injuries. So this is the example of the parts of triangular bandage. Two phases of bandaging. An open phase bandaging is used for wounds on top and back of the head, chest, back, hand, and foot, and as arm sling. A cravat-based bandaging is used for wounds that need extra support like wound on the eye, forehead, ear, cheek, jaw, shoulder, hip, arm, leg, elbow, knee, and palm, and for a sprained ankle. And narrower the cravat is, the greater pressure it will give. So this is the example of triangular bandage. So the cravat fold and the cravat close. Techniques in bandaging. Keep in mind the following. Always use a square knot. Keep the cloth sterile to avoid infection. Always keep the ends. Bandaging techniques depends upon the size and location of the wound. Your first aid skills and materials at hand. Bandage firmly over bleeding and securely over the broken bone. Not so tight so as not to cut off blood circulation. When wrapping bandage around the body, such as knees, ankles, neck, and small back, use its natural hollows to slide the bandage gently into place. Since most injuries swell, check regularly to ensure that the bandage is still comfortable and that it remains firmly secured. Secure the bandage with a tape, clips, or a bow or square knot. Ensure that the bandage, especially the knots, do not touch the skin. So this is the example of how to do a square knot. Right over left and left over right. Wounds. A wound is a break in a continuity of a tissue in the body. It may be closed in which there is no break or damage in the skin. It is also called hematoma or contusions. A wound may also be an open one in which there is a break in the skin. So this is the kinds of open wounds: puncture, abrasion, incision, laceration, avulsion. Puncture is a piercing wound caused by nails, needles, and other pointed object. Abrasion is caused by rubbing or scraping the skin against a rough surface. Incision is a cut caused by knife, broken glass, or any sharp object. Laceration is a blunt breaking or tearing of soft tissues, usually resulting from mishandling tools and other accidents. Avulsion is a forcible tearing or partial tearing away of tissues. How to manage wounds. For management of hematoma, we use the mnemonic RISE: resting the injured part, ice application, compression, elevation. First aid for open wounds with severe bleeding. Wear gloves and remove or cut clothing as necessary to expose wound. Control bleeding by applying direct pressure. Elevate the injured part above the heart, except for eye injury and wounds with embedded object. Cover wound with sterile dressing and bandage. Care for shock. Consult a physician immediately. Carrying and transporting an injured person. How will you bring me to a safe place? An injured person needs your help. You are to bring her to a safe place. How are you going to do that? Study the situations and determine the kinds of transport that should be used. So these are the different kinds of transport. Transporting an injured person to a safer place requires great care. A first aider must undergo proper training. When doing this, a first aider must consider the following factors: A. Weight and height of the victims. B. Status of the victims, conscious or unconscious. C. Environment: safe, floor smooth, narrow, or wide. D. Special need considerations in injuries of the victims. So, fireman's carry. Fireman's carry, the easiest way to transport a light and smaller victim. Piggyback carry, when the victim is conscious. Packstrap carry, when the victim is smaller than the first aider. Shoulder drag, used when the floor is smooth, short distance transport. Fireman's drag or tide, hand scroll, used when first aider and a victim must crawl underneath a low structure. Blanket drag, used when the victim is seriously injured and should not be left. Two-man carry, chair or set carry, when there are two first aiders and a chair is available. Three or more man transport or hammock carry, when there are three first aiders. Bearer alongside carry. Carriers will stay at the uninjured side of the victim. 6 man left and carry, when there are six first aiders. First aid for common unintentional injuries. Heat exhaustion is caused by loss of salts and water due to excessively high temperature. This may lead to heat stroke and even death. First aid: transport a victim to a cool place, give him/her plenty of water, check for vital signs, seek for medical help. Next is fracture. Fracture is a break or crack in a bone. An open fracture pierces the skin surface, while in a closed fracture and the skin above is intact. First aid: check vital signs, do not move the injured part, stop bleeding if there is any. If you have to move the person, immobilize the broken part by splinting, then seek medical help immediately. Food poisoning is caused by consuming food or drink that is contaminated with bacteria or viruses. First aid, help the person to lay down and rest. Give him plenty of flavorless fluids to drink and a bowl to use it. He vomits. Call for medical help if the conditions worsen. Sprain is an injury to the ligament of a bone due to accidental tearing or overstretching. Strain is an injury to the muscles which is a result of improper use of the muscle. First aid, rest the injured part, apply ice, compress the injured part, elevate the injured part. Drowning happens when air cannot get into the lungs because of water. It can cause immediate death when taken for granted. First aid, lay the person on his or her back, check breathing and open the airway, give rescue breath and best compression if necessary. If the person is breathing, place him/her in the recovery position. Treat for hypothermia by removing with clothing and covering him/her with dry blanket. Heart attack is caused by sudden obstruction of blood supply to the part of the heart muscles. First aid, help the person sit or lay down with head elevated. Call for medical help. If the person is conscious, give him/her a full dose aspirin and advise him/her to chew it slowly. Constantly monitor the vital signs. Be prepared to give rescue breath and desk compression. Chemical burns may occur when electricity passes through the body. First aid. Make sure that contact with the electrical source is broken. Flood the sites of injury at the entry and exit points of the current with plenty of cold water. Wear disposable gloves and place a sterile dressing or a bandage over the burn to protect it from airborne infection. Call for medical help. Reassure the victim and treat for shock. Heat stroke is caused by a failure of the thermostat in the brain to regulate body temperature. When this happens, the body becomes seriously heated. First aid, move the person immediately to a cold place. Remove as much of his outer clothing as possible. Call for medical help. Wrap the person in a cold with heat and keep the sheet wet until his temperature drops to 38 degrees Celsius or 37.5 degrees Celsius under the tank of armpit respectively. If the person has returned to normal temperature, replace wet sheet with a dry one. Monitor vital signs until help arrives. If temperature rises, repeat the cooling process. Burns are often due to domestic incidents such as touching a hot iron, friction, rope burn, or spilling boiling water on the skin. First aid. For for minor burns, flood the injured area with cold water for at least how long to stop burning and relieve pain. Put on gloves and cover the area with sterile non-adhesive dressing or bandage. For severe burns, help the persons to lay down and prevent the burns area from coming into contact with the ground. Douse the burn with plenty of cold liquid. Seek for medical assistance. Do not delay medical help. Wear disposable gloves and gently remove any rings, watches, belts, shoes, or smoldering clothing before the tissues begin to swell. Carefully remove any burns clothing unless it is sticking to the skin. Cover the burns area with non-adhesive dressing or bandage. Continue to monitor vital signs. Reassure casualty and treat for shock. Stroke is a condition in which the blood supply to a part of the brain is suddenly and seriously impaired by a blood clot or ruptured blood vessel. First aid, if the person is continuous, help him to lay down with his head and shoulders slightly raised and supported. Incline his head to the affected side and place a towel on his shoulder to absorb any dribbling. Call for help, loosen any tight clothing, monitor vital signs and reassure the victims. If the victim is unconscious, give rescue breathing and chest compression, call for an ambulance or call for help. Okay, any clarifications, suggestions about our topic this morning? So if none, thank you so much for listening, and don't forget to open your LCMS and subscribe our YouTube channel at www.gaitf.com.